Okay, let's review our final steps prior to surgery. You will be having a pre-admission testing appointment with our anesthesiology team. This is likely going to be scheduled for you about 1 week prior to your surgery date. This is because we will be doing COVID testing at this time. Everyone must be COVID tested prior to surgery, even if you've been vaccinated or have already had COVID. If you are confused about when your pre-admission testing has been scheduled for, please reach out to our office. You will also have a consent signing appointment. This is usually your last office visit. At this time, you will go over the consent form with your surgeon. They will also be ordering you the Lovenox shots. We're going to talk more about the importance of these shots, but you should take note that these are ordered prior to your surgery, but they are to be used after. So we order them ahead of time so that you don't have to go to the pharmacy after your surgery, but you will be administering them after surgery. Your consent signing appointment will also be when we give you the antibiotic soap. This will come in a small blue bottle, and you will use it the night before surgery as well as the morning of. If you have not received this soap after your consent signing appointment, please contact the office. We'd like you to remember that you must stop taking any NSAID medications 10 days prior to surgery. This includes things like aspirin, Advil, Motrin, and Aleve. Tylenol is okay. As for your surgery time, you will receive a phone call the day before your surgery, and they will let you know what time your surgery is at and where exactly to report to. This will be the business day before your surgery. So for example, if you are having surgery on a Monday, you will get a call on Friday. If you are having surgery on a Tuesday, you will get a call that Monday. As an important reminder, the day prior to your surgery, you can only have clear liquids. Please do not have anything by mouth after midnight before surgery. There are certain things you can do to prepare ahead of time for surgery. For one, you can be sure to stock up on all of your vitamins, Tums, clear liquids, sugar-free popsicles, Jell-O, and Crystal Light prior to surgery. You could also consider purchasing something called an abdominal binder that you see here in the picture. These can be found for only about $10, $15 off of Amazon or a medical supplies store. Patients say that this can help with muscle soreness after surgery. It is not a requirement though, just a recommendation. You should make sure that any medical equipment that you use in your home is working. Specifically, if you have sleep apnea, diabetes, or hypertension, please make sure you have the proper equipment. If you use a CPAP machine for your sleep apnea, you must bring this to the hospital. They will not provide one for you. And you do need it to ensure appropriate dispensing of your pain medication. So you will not be allowed to proceed with surgery if you do not have your CPAP machine. Additionally, if you do have high blood pressure and or diabetes, you should have a blood pressure cuff at home and a glucometer. This is very important because your medications will be changing very quickly after surgery, and it's likely that you will only need to take certain medications if your blood pressure is above a certain level. Same thing with your blood sugar. So if you don't have a way of checking this at home, that could be dangerous. If you don't have any of this equipment, please call your PCP's office, or if they're not able to help you, of course, you may call the surgery office. As for what to bring to the hospital, again, you must bring your CPAP machine. We do recommend putting a piece of tape on all parts of the equipment with your name on it. Any personal toiletries that you'd like, although it will also be supplied by the hospital. We will be giving you a water bottle at discharge, so you do not need to bring your own. And some patients do like to bring their binders with them so that they can refer to it. You don't need to. We will be giving you a discharge packet with pertinent information, but please make sure you know where the binder is. This is going to be a very important resource for you while you are at home recovering. I'd like to take a moment to review the anatomy of our surgeries. Many of you have not reviewed this since possibly your initial consultation. For those of you who are receiving the sleeve gastrectomy, the surgeon is going to be going in and removing about 80% of your stomach. And you can see here on the screen, this is what is being taken out and sent to pathology. This will affect your hunger because there are hormones in this part of the stomach that when they're taken away, you will no longer feel the same type of hunger signals and cues. You'll also be left with a very small tubular portion of the stomach. It's about the shape of a small banana or toothpaste tube. So you'll only have to eat a much smaller amount in order to feel full. You can see here on the screen that people can lose anywhere from 50 to 80 pounds. But I always like to point out that everyone is different. Some people can lose more than this, and some people can lose less. It's more about what you do with it than the surgery itself. This is our gastric bypass. This surgery is a little bit different in that nothing is being removed. So the surgeon is going to go in and put a staple line on to separate a small pouch from the rest of your stomach. They are then going to make another surgical point here to bring up the intestine. So food is going to enter your esophagus, bypass most of your stomach, and then rejoin the rest of the small bowel. The stomach stays in the body and does make gastric juices and enzymes, which will travel down and eventually combine with the food. This does allow for very rapid weight loss, like the sleeve. I have here that weight loss can be closer to 60 to 90 pounds with this surgery. However, again, everyone is different. We've seen people lose more and we've seen people lose less. I don't like anyone to get hung up on the specific numbers or to compare themselves to anyone else. We do have a third surgery that's not as common, but you may be receiving the biliopancreatic diversion with duodenal switch. This is only appropriate for those who are starting with a BMI of 50 or above, as it's intended for extremely significant weight loss, up to sometimes 150 pounds. This is again a two-part surgery and is sometimes done in two parts, with the sleeve-like portion being done first, and after some weight loss is achieved, the second part is done. But half of the stomach is removed, similar to the sleeve, but then the stomach is connected to the last 250 centimeters of the small intestine, and the remaining small intestine is connected 100 centimeters from the end of the small bowel, where the food will mix with the digestive enzymes. I like to review the possible complications that can occur after surgery. You have likely been briefed on this already by your surgeon, especially if you've already had your consent signing appointment. But we like you to be prepared and understand every possible risk because no surgery comes without a risk. A stricture is something that can happen when there's a narrowing between the gastric pouch and the intestine when we're talking about the gastric bypass, or a narrowing in the stomach portion of the sleeve. Food is unable to pass through, and so you may find that you're unable to tolerate food and possibly vomiting after you're eating. Generally, the treatment with this is an upper endoscopy where the surgeon will go in with a small camera and balloon, and they'll blow up that balloon in order to stretch out the area that has been condensed. A leak is a very serious complication that could occur between the connections of the stomach and the intestine in a bypass or along the staple line of the sleeve. Everyone is tested post-operatively for a leak in the hospital, but it could also occur immediately post-op at home. Signs and symptoms would include a rapid heartbeat, severe abdominal pain, and fever. This could require a reoperation. You should know that leaks, while they could occur, are very rare. I'd like to talk about what you can expect after surgery. For those who are getting a gastric bypass, you will likely have a urinary catheter placed. This will be done while you're asleep in the operating room and is generally removed first thing in the morning. We will make sure that you are urinating normally on your own before sending you home. Nausea and abdominal soreness are two things that are very common after surgery. We want you to let us know, though, if something doesn't feel right or if these things aren't going away with pain medicine and time. If you have nausea that lasts for longer than a few minutes and is consistent in that first week after home, we would like to know about it. It really should be resolved fairly quickly. It's also very normal to feel soreness and some pain after surgery. This is a major surgery. However, usually that first stay, either in the hospital or sometimes the first day home, are the worst parts of it, and it will improve gradually every single day. You should not be afraid to need pain medications, though, for those first few days or even a week. It's normal, and they're prescribed for a reason. Constipation is something that is very common after surgery. This is because you're on narcotics, the pain medications, you have decreased activity and probably decreased fluid intake, and you're also not eating solid food, so all of these things are a perfect storm for constipation. We ask that you don't go more than 4 to 5 days without having a bowel movement before contacting us. We're likely going to recommend something like milk of magnesia, Dulcolax, or even a suppository if needed. Sometimes you will be discharged home on liquid Colace just to prophylactically prevent against constipation. I'd like to talk now about how to stay hydrated, and this is something we're going to be emphasizing a lot, both preoperatively and when you return home. In the hospital, you're generally going to be started on fluids the day after your surgery. So you'll usually have surgery in the morning, and then the next morning, 24 hours later, we'll start you on the clear liquid diet. You'll be hooked up to fluids while you're here, and so we're not really worried about you getting dehydrated while you're in the hospital with us. These fluids are mostly intended to just make sure that everything is going down normally without any pain. We'll give you small 1-ounce cups and ask you to drink about 1 to 2 ounces per hour. Again, that's while you're here with us in the hospital. Your staple lines are brand new and swollen, so it is imperative that you sip very slowly. 1 ounce should take you about 15 minutes to get down and should be separated out to about 4 different sips. You'll be given clear liquids like Crystal Light, water, broth, and diet Jello. You may also experience a change in preference for liquid temperature, meaning that before surgery, you may have enjoyed drinking very cold liquids or very warm liquids. After surgery, though, you may find that you don't tolerate that. Generally, room temperature liquids are best tolerated. When you get home, you'll no longer be connected to the IV fluids, and therefore we're going to ask you to increase your fluid intake to prevent dehydration. You are going to aim for about 4 ounces per hour or 1 ounce every 15 minutes. This will total about 60 ounces for the entire day, and this is including all your clear liquids. So if you have some Jello or you have some broth, that counts as well. Remember, while the amount is very important, we still want you to be going very slowly. Why are we so obsessed with making sure that you don't become dehydrated? That's because this is the most common cause for readmission or coming to the emergency room, and we do not want that to happen to you. So you should know what the signs and symptoms are of dehydration. The most important one that you'll look for is the color of your urine and how often you're urinating. When you're home, you should be going at least 3 to 4 times a day, and you want it to be a nice pale yellow. Other possible signs of dehydration would be fatigue, nausea, dizziness, or extreme weight loss, although that's unlikely to happen in the very beginning. And why is it that it's hard to stay hydrated? Because your body is not going to ask you for fluid like it does prior to surgery. Right after surgery, the response is going to be so extreme that this on the left is going to be what you want, but this is going to be what you need. So if you rely solely on your hydration signals to stay hydrated, it will not be enough. I would also like to ask you to please stay on your clear liquids only until your first post-op appointment. If you've been reading your binder, which I hope you have been, it will say that clear liquids are for 1 week after surgery. However, sometimes because of the calendar, your first post-op appointment will be maybe 8 days after surgery. But we would still like you to wait to advance until we see you in person and give you the okay. Now I'd like to discuss how we can prevent pneumonia and blood clots after surgery. we will be giving you something called the incentive spirometer while you're in the hospital. This is to help clear up any phlegm that builds up in your lungs and to prevent you from getting post-operative pneumonia. We'll teach you how to use this in the hospital, although it's not hard, and we are going to ask you to use it frequently after surgery, about 10 times an hour while you're up. Additionally, we're going to be giving you post-operative Lovenox, which I did mention in the beginning of the presentation. This is to prevent blood clots, and it is an injection that you'll take post-operatively, meaning for that first 1 week after surgery. Again, it is a needle, but it is not very hard to administer, and generally we'll have the visiting nurse who comes to see you after surgery help you with this. To help the Lovenox work, we do ask that you get up and walk around about a couple of times a day. We don't want you sitting in bed all day because otherwise your blood won't flow. And remember, you'll take this Lovenox for 7 days after surgery. Things you want to remember after discharge, and again, we will review this with you in the hospital before you go home. You'll want to increase your clear liquids to 40 to 60 ounces daily and try and keep a fluid journal. We will be giving you one before you go home. Let us know if you're having any nausea or vomiting. You may shower the day after you get home, but please no baths, hot tubs, or pools until you're completely healed. We will be arranging for a visiting nurse to come visit you when you're at home. They will help you with the Lovenox injection and take your vitals and make sure everything is okay. Remember to take this time to be a patient and allow yourself time to heal. Please keep in mind that no two patients are alike. This goes for every part of the process. Some patients get through the process in 4 months, some in 6, some in a year. Everyone is different, okay? Some people stop taking pain medicines the day after surgery. Some need it for that entire week. That's okay. Some patients find that the weight comes off quicker. Others find that, yes, it may be consistent, but it's slower. Many of you may have friends who have had weight loss surgery, and it's great to talk to them about your struggles, your successes, and so on. But do not compare yourself to them. Also, please take advice from only those on your healthcare team. Well-meaning healthcare providers may mislead you because they don't understand your specific operation. For example, someone may think that clear liquids could include 100% apple juice. Maybe they're even in the health profession. But you know that on your clear liquids, you cannot have any sugar. We've trained you well, and you should really trust your instincts. And the third thing, please bring any questions to us. I hope you know by now that we're here to help you and support you, and nothing is trivial. We would much rather hear from you than not. I want you to think about support group and consider making it a priority. We hold support group the first Wednesday of every month from 5:30 to 6:30. Please check in with us about whether it will be virtual or in person. It's a really helpful time to come together and talk to other people who are experiencing similar things. Please don't forget to complete your quiz after this video is over. You should have received this quiz when you either started the program or when you chose your surgery date. You can complete it and either return it to us in person or email us. We'll go over any questions that you may have. Lastly, let's remember why we're here. You've done a lot to get here, and I can promise you that not everyone who starts the process gets to this point, so you should be proud of yourself. You should also remember why it was that you decided to pursue weight loss surgery in the first place. Sometimes people want to get off their diabetes medication or their hypertension medication. Some people want to be able to keep up with their grandkids or their children. Others want to do smaller things in life without trouble, like tying shoes, riding a roller coaster, or going on an airplane. There's many different reasons why you may have called us, and you want to remember what those reasons were for you. Thank you guys so much for attending our presentation, and please remember to reach out with any questions.